Hey everyone, and welcome back to the Rules of Thumb podcast with Dr. G. I'm your host, Nick Gollenbo, and this week we're going to jump right into my newest article titled A Hand Surgeon's Guide to Nail Trauma and Treatment. Last week, we talked about fingertip injuries in general, but I promised we'd dive deeper into nail injuries specifically. These little joys certainly deserve their own article. I find nail injuries to be fascinating. They're incredibly common, yet there's still so much confusion about what to do with them and what not to do. Let's clear that up. We'll start with the anatomy you need to know. Before we dive into the injuries, let's get on the same page about the anatomy. Your nail isn't just the hard part that you clip every few weeks. There's actually a complex system under there. It's crucial to understand. I think of the nail as three main parts, as can be seen in the image in the article. The actual hard nail is called the nail plate, but underneath that, in the pink area that you can see through the nail, that's called the nail bed. The pink part is called the sterile matrix of the nail bed. This functions as an adhesive to stick the nail plate down to the finger. When this layer ends, you get lift off of the nail and it looks like it turns white. This is the part we trim when we cut our nails. And that white sort of half moon shape at the base of your nail, that's the germinal matrix portion of the nail bed. And it's the powerhouse. It's literally the factory full of stem cells that produces your nail. Damage this area and you could have permanent nail problems. Types of nail injuries. So here's where it gets interesting. Nail injuries typically fall into three main categories, and knowing which one you have makes all the difference. First is subungual hematoma. This term is a fancy way of saying you have blood under the nail. It usually happens when you smash your finger in a door or accidentally hit it with a hammer. The image in the article is a good example. A helpful, though not perfectly accurate question here is how much of the nail is involved. If it's less than half the nail, it's quote-unquote acceptable to do nothing. By acceptable, I mean you have a relatively low, but not zero, chance of a permanent deformity from what could be an untreated nail bed injury that's lurking underneath. When under 50%, it's also reasonable to have a professional drain the blood by creating a small hole in the nail. This will relieve your pressure and thus your pain. If it's more than 50%, you might need the nail removed and repaired. The next is nail bed lacerations. These are actually cuts in the nail bed itself. Typically, this will go straight through the nail plate or again, some sort of smash injury. And the tricky part, you often can't even see them until you remove the nail. That's why the 50% rule that I introduced above is far less than perfect. But if you have a large blood collection under the nail that's painful, there's a good chance you have a laceration under there. See below for how we decide what to do about these. And the last category are what we call nail bed avulsion injuries. These are the nasty ones. In this case, part or all of the nail gets ripped off, which in and of itself is not really a problem, but it often takes some of the nail bed with it. These almost always benefit from surgery to try to salvage what we can of the nail bed for a reasonable chance of healing. Sometimes we will even borrow nail bed tissue from another finger or toe to fix it, though this actually sounds better in principle than it is in reality. For the surgical decision, here's something that surprises most people. Sometimes what looks terrible won't really benefit much from surgery, and sometimes what looks minor definitely could use the OR. The biggest factor in this decision is that germinal matrix. Remember, that's our nail factory. If it's injured, you're almost certain to get a nail deformity. Depending on the severity of your injury, and your tolerance for a funky nail, surgery may be your best bet. Even in that case, it's important to understand that surgery can only decrease, but not eliminate, the chance of a nail growing back with a deformity. The same decision tree exists when we're dealing with a laceration through the sterile matrix portion of the nail bed. In this case, the severity and likelihood of permanent nail bed injury are just somewhat lower than when we're dealing with the germinal matrix. Let's talk recovery and expectations. Regardless of whether you're dealing with a surgical injury or not, these injuries take time to heal. Your nail grows about 1 millimeter per week, so it'll take 4 to 6 months for a new nail to grow in completely. It's not a quick process. The good news? Most nail injuries heal remarkably well if they're treated properly. The bad news? You won't know exactly how your nail will look until it grows out completely. So some takeaways from today. The size of the blood collection under your nail can be a helpful clue to determine whether you would benefit from surgery. Injury to the germinal matrix, which is the nail growth center, is the biggest concern for long-term nail appearance. And complete nail healing takes 4 to 6 months, but most people get good results with proper treatment. Looking at your smashed finger and wondering if you need to see someone? When in doubt, get it checked out. Your future nail will thank you. Appreciate you being here today. We'll see you next time.